Professor Carolyn Tuohy, welcome to London and the Nuffield Trust. You're here to talk about your forthcoming book and some of the ideas that you have about the forces that shape health policy in different countries. And one of the key ideas that you've been thinking about is the role of a new player, the institutional entrepreneur. Can you explain to me what an institutional entrepreneur is and their role in health policy?
We're used to thinking about entrepreneurs in the business sector. Entrepreneurs are people who see opportunities to combine some set of resources in a new way that's going to yield value for some set of consumers. Political scientists have tried to translate that concept into the public sector, and they've talked about policy entrepreneurs who bring policy solutions together with policy problems in politically saleable ways. I want to think about entrepreneurs who work across the boundary between public and private sectors, who actually combine a public mandate with some private sector resources, whether it's professional expertise, practice management, private capital. And these are new players that are emerging in the context of market-oriented reforms in healthcare, and they're having very dynamic effects.
Now, you've identified examples of these in the English context. Tell me about who you mean.
I think the principal example of an institutional entrepreneur, in fact, I would say this is true cross-nationally. Britain, England stands out for the importance of general practice commissioners, GP commissioners, and the dynamic role that they have played from the time of the internal market reforms of the 1990s right through to the current coalition reforms. You can argue that institutional entrepreneurs, these entrepreneurial GPs, took what was a marginal reform in the internal market, showed how it could work in practice, kept the idea alive through a period of policy cycling under the Labour government, and brought it right to the center of the current reforms with clinical commissioning consortia. That is a remarkable role. It is, to some extent, an accidental role. As I said, this was an aspect of the internal market reforms that was not seen at the time as being one of the principal characteristics, but it was certainly one that had very fateful results.
What kind of influence did these people have, do you believe, in the process of policy formation that's resulted in the current Reform Act?
Yes, I think they had influence within their own professional sectors. These were people who assumed political leadership, some of them, within the profession, founding the NHS Alliance and the National Association for Primary Care. They were very active in continuing to talk to politicians on both sides of the aisle, and really in all three parties. They didn't particularly shape the details of policy. That wasn't their role. Their role was to have a demonstration effect and to keep these ideas alive, as I say.
Is it possible to predict whether this sort of player is going to increase in number over time, maybe from some of the other examples you've noticed in other countries?
It's a very interesting question. It's in the very nature of entrepreneurialism that we can't predict when it's going to emerge. But since we do see it in other countries, in the Netherlands, for example, we see what the previous social insurers, sickness funds, having played this very important role of institutional entrepreneurship. I would say in the current U.S. circumstance, it is the founders of the health exchanges in Massachusetts in particular, to a lesser extent in Utah with a very different model, that have played such a role. So the fact that we're seeing them across nations in market-oriented reform contexts suggests that these are players that are likely here to stay.
Do they in any sense represent a threat to some of the more established players in health policy systems? I'm thinking particularly of some of the professional groups who would also think that they represent professional interests in some way.
Of course, and they do to some extent. What institutional entrepreneurs do is to introduce a very dynamic element into the process. They make the arena more pluralistic. I'm speaking in political science terms now. They make coalition building a little more complicated. So in that sense, I suppose they are threatening to established interests, but they are important players on the scene. They are part of a coalition of support for any reform, I think, in the future.
Carolyn Tuohy, thanks very much indeed for talking to us.
Thank you very much for inviting me.